This solution is used to treat a wide variety of bacterial infections by stopping the growth of bacteria. It treats only bacterial infections and will not work for viral infections like the common cold or flu. It's important to only use this medication when it's needed to ensure it will work for future infections. It should not be used to treat meningitis. This medication is given through injection into a vein or muscle, as prescribed by your doctor, usually 2 to 4 times a day. The dosage is determined by your medical condition and how you respond to the treatment. For children, the dosage is also based on their weight. If you are administering this medication to yourself at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If you see either of these, do not use the liquid. Also, learn how to store and dispose of medical supplies safely. Antibiotics work best when the amount of medicine in your body is kept at a constant level. Use this drug at evenly spaced intervals. Keep using this medication until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early may result in the infection coming back. If your condition lasts or gets worse, be sure to inform your doctor. When using Clindamycin Phosphate-D5w solution, Intravenous Piggyback, you may experience nausea, vomiting, or a metallic taste in your mouth. If these effects persist or worsen, contact your doctor or pharmacist. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of potential side effects. Serious side effects are rare, but it's important to notify your doctor if you experience persistent nausea or vomiting, pain or swelling at the injection site, dark urine, or yellowing of the eyes or skin. Prolonged use of this medication may lead to oral thrush or a new vaginal yeast infection, so be sure to contact your doctor if you notice any changes in your oral or vaginal health. Additionally, seek immediate medical help if you experience symptoms of a serious allergic reaction, such as fever, rash, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so always consult your doctor or pharmacist if you notice any unusual effects. If you're taking Clindamycin Phosphate-D5w solution, Intravenous Piggyback, be aware that it may rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur weeks to months after treatment has stopped. If you experience diarrhea that doesn't stop, abdominal or stomach pain/cramping, or notice blood/mucus in your stool, it's important to inform your doctor right away. It's also important to note that if you have these symptoms, you should avoid using anti-diarrhea or opioid products because they may make symptoms worse. Before using clindamycin, it's important to let your doctor or pharmacist know if you have any allergies to this medication or similar drugs. They may contain ingredients that can cause allergic reactions. Make sure to discuss your medical history with your doctor before starting this medication, especially if you have kidney, liver, or stomach/bowel disease. It's important to note that clindamycin may affect the effectiveness of live bacterial vaccines, so make sure to inform your healthcare professional if you are using clindamycin before getting any immunizations or vaccinations. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you are using. Older adults may be more sensitive to the side effects of this medication, particularly diarrhea. If you are pregnant or breastfeeding, make sure to consult with your doctor before using clindamycin. It's important to be aware that Clindamycin Phosphate-D5w solution, Intravenous Piggyback, may interact with other medications, which can affect how well it works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safety and effectiveness of your treatment. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. While using clindamycin phosphate-D5w solution, Intravenous Piggyback, your doctor may conduct lab and/or medical tests to monitor your kidney and liver function. Make sure to consult your doctor for more details on these tests. Be sure to take each dose of the Clindamycin Phosphate-D5w solution, Intravenous Piggyback, as prescribed by your doctor. If you happen to miss a dose, speak with your doctor or pharmacist to determine the best course of action. It is important not to take a double dose to make up for a missed one. Remember to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. When it comes to discarding the product, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.